Nicola, I mean, ICU beds may not necessarily be exactly what a cancer patient needs, because quite often the disease progresses in a certain way that you don't necessarily need to be in ICU the whole time. But it's a good example. It comes from Tulsa, Oklahoma. The city has run out of ICU beds. So it just shows the strain that the pandemic is placing on healthcare.
Yeah, it really does, Adnan. I mean, this is why this study was carried out by Dr. Agarwal and Professor Tim Hanna, who's from Kingston in Canada. And, I mean, they looked at 1.2 million patients. They looked at studies involving them over the past 20 years. And they were doing it initially because they wanted to determine whether these delays in treatments do have a major effect or not, because apparently there just wasn't the studies done across all of the cancers. And both of them said to me that they were stunned by these results. One of the facts that Dr. Agarwal told me was that if you do have a 12-week delay for bowel cancer, whether it's surgery or whatever, and that was what was happening at the beginning of the pandemic, that increases the risk of dying by 40%. I mean, you're right about the fact that they're running out of ICU beds, but you've got cancer wards, and a lot of these treatments ordinarily don't necessarily mean that people are staying in hospitals for that period of time. Chemotherapy was delayed at the beginning of the pandemic because obviously you had to weigh up the risk of whether or not somebody who's got cancer should go into a hospital environment and whether they should possibly come into contact with somebody else with COVID. And we've had those figures of certain people in hospitals who've actually contracted the coronavirus because of being in hospital. So what both of these experts, they're both cancer doctors themselves, are saying is that we really need to consider what the long-term impact is going to be on delaying treatment, and the fact that that's going to have a devastating effect. I mean, you know, we've been discussing sort of the amount of people who've died of other diseases other than the coronavirus. There was certainly at the beginning of the initial lockdown here in the UK, the statistics showing that hardly anybody went to hospital, even if they had heart attacks, because they were so worried about catching the coronavirus. But what the two specialists that I spoke to from this study said is that we really have got to continue treating people now, because if you don't, if you are delaying it, not only are you putting people's lives at risk, such as Beth Purvis, who was just the most delightful person to interview, but you're also then adding up to the complications of healthcare by delaying treatment and also by delaying diagnosis. People are much sicker, so they need much more detailed treatment. It's more expensive. So they're saying also it's just not cost effective to do this.
Nicola, is there any data about oncologists having to leave their specialism and concentrate on coronavirus patients? In Italy, again, when we look at what was happening in March and April, when Italy was the worst affected country in Europe, doctors across different specializations were saying we're all treating COVID-19 patients.
Yeah, it's interesting how people initially weren't they? They were being directed to go and treat coronavirus patients. I mean, I actually know a lung cancer specialist here in the UK. She works at the Marsden, which is one of the top cancer hospitals. And initially what she was saying is that every patient who came in to see her was treated as a potential coronavirus patient. And she had to wear her full PPE the whole time. The patients had to be tested and double tested. And only when they were clear could they then go onto the cancer ward and receive their cancer treatment. So although she's a professor, she personally wasn't just dealing with coronavirus patients. She said that she did lose most of her team because they were diverted to treat the enormous numbers of people who were coming into the hospital with coronavirus.
Nicola, thank you so much indeed. Our health correspondent, Nicola Hill, speaking to us from London.